manifest, form. It is call the meeting to order. Kind of Fairfield Board of Health, Monday, October 18th at 7:32. Welcome everyone. Hopefully everyone had a chance to take a look at the minutes from our last meeting. Does anyone have any comments, questions, edits? If not, if I can get a motion to approve the minutes from the last meeting. Second, please. Second, all those in favor? Any opposed, abstentions? Thank you. All right. Moving on to our Director of Health report.
Sure. So, shorter report this month. On the first selectwoman lifted the indoor mask mandate for the town, and so that affects businesses and local entities. That is no longer a requirement, but a recommendation to wear masks indoors. Right now in Fairfield, this past month we hit a couple landmarks in terms of we went over 6,000 cases, and we went over 200 deaths. We're at 6,056 cases, 216 deaths. Right now, Fairfield U only has 2 cases, and Sacred Heart only has 3. Fairfield Public Schools so far this year has had 59 cases among students, 18 among staff, and currently we have 66 students in quarantine and 0 staff in quarantine, unless that changed today. In terms of the categories for the town, so we talked about the CDC's category in the state, for the county and the state's ranking of the individual towns. The towns have this ranking based upon how many cases you have of gray, yellow, orange, and red. We were up in the red, and we've come down now to the yellow for the past 2 weeks. We did get down to as low as 6 cases per 100,000, and we crept up to 7, and this week we're sort of hovering around 8, but we still think we'll stay well in the yellow category if things keep going as they are. We did see, essentially, we came down. We had been coming down for several weeks, as the selectwoman shared in her update, and we had a really low week 2 weeks ago, and with like 20 cases for the week, but that went back up and kind of even with the week prior to. So, if you look at the last full 3 weeks, it was kind of like 41 cases, and we dropped down to around 20, then we went back up to 41. So it's kind of level, and we think this week will probably be right around the same. The next couple of days will tell us where we land with that. And the CDC still has the county at the substantial or the orange category. State and county hospitalizations, while they had been trending downward, we're starting to see for the last 2 weeks like a very slight upward trend. Nothing significant, not any kind of sharp increase, but we had seen sort of a little bit of a leveling, and then just a slight increase these last 2 weeks. Of the new cases in the last 7 days, 73% have been amongst those individuals not fully vaccinated. 27% of those were vaccinated. And just to talk about where we stand with our vaccination rates, we hit a couple of good landmarks. In terms of everybody who's currently eligible to be vaccinated, so taking away the 9,653 kids that are less than 12, we hit 85% have received at least 1 dose, and 80.1%, or over 80%, are now fully vaccinated. That's amongst everybody that's eligible. When we look at amongst all residents of the town, regardless of eligibility, we're at 71.86, or 72% receiving 1 dose, and 67.62% that are fully vaccinated. So we still got a way to go, but we're getting there. One of the notable things that we did hit with the 65 and older crowd. Now, this is a factor of, I'm guessing it's a factor of boosters, because we have more people vaccinated than we have people in the 65 and older category. So we hit 100% for.
Just let me know if you need any help, because I'm kind of just counting some stuff up pretty straight. And you know, there's a couple other.
So some good numbers there. We did get notification that the boosters, since the last meeting, that the boosters for Pfizer, Moderna, and J&J are now recommended, and so we are in the process of sort of rolling that out. We've done some Pfizer's, and we are in collaboration with Griffin Hospital, and we'll be working with doing a Moderna booster clinic. We did mostly Moderna in our clinic, so we'll be doing a Moderna booster clinic, and we're sort of finalizing the details of those in the next day or two, and we'll roll that out. And then
Will you announce by email, by like your Instagram or something?
We'll do it everywhere. You know, social media. We'll get it in the newsletter for the supplement sends out. It'll be on. We'll do a press release. And in addition, the 5 to 11-year-olds will be doing those clinics as well. Once that's approved, we expect that approval sometime in early November. Right now, that's the ACIP. The FDA is scheduled next week, and ACIP for the CDC is scheduled November 3rd and 4th, is it? Or 4th and 5th?
I thought it was 3rd and 4th.
3rd and 4th, yeah. So we expect that to be approved, and then, they still haven't given us the opportunity to order. The vaccine is a different whole packaging and everything, different, so we have to order that specifically for that age group, and so they haven't given us the opportunity to order that yet. We were told that we should be able to order it prior to the launch of that, so we should be able to get that in hand, and we'll probably have something right around that time. Maybe not, on the first day it's available, but somewhere right around there. And we'll initially be most likely doing it through appointments, just to gauge the demand, and then once the peak demand goes down, then we'll just do walk-ins. And
James, I'm sorry.
Sure.
And from my understanding, they don't anticipate having problems with supply.
No, they haven't indicated that. They did, on the CDC call, they did say initially there's, first week they did say you're limited to 300 doses for the first week and 100 for each week after. And then they came back and said that's a minimum order that you have to place. So, I'm a little, trying to follow up on that, but they seem to hunker down on minimum. So it seems like we should be able to order what we need, but they haven't indicated of any shortage or anything like that. But we'll see when it comes down to ordering whether we actually get it. We order, 500 or 1,000 doses and see what happens there. But we did our flu clinics the 7th and 8th of October. We did almost 1,100 doses over the 2 days. And we tried with working with Jill to have Griffin and DPH vans come there, and they did co-located with us, and so they did the COVID vaccinations, and we took care of the flu ones. And so people that came through that wanted a booster, wanted the first shot, wanted an additional dose shot, they were able to get it there, and the folks from there, Griffin kind of took care of all that paperwork and the inventory and all that. So it was a good collaboration they did over the 2 days. I think it was 95 shots.
From Griffin?
Griffin, yeah, it was 45.
They did 88 boosters, and the balance is just like a half a dozen.
Yeah.
First or second.
So for them, that was.
They had a J&J,
Yeah. For them, that was a fantastic clinic. They are actually begging to come back.
Oh, they want to come back. They thought the 80 doses were crazy. They want to be with us again.
A lot of their clinics, they go and set up someplace and they do 2 or 3 during the day. They were even happy with the high school ones where they did 25.
Well, that was a
They
thrill.
thought those were great.
And it was.
And so we kept them busy, but they weren't like slammed or anything like that. So, but we may keep doing that going forward in terms of once we get through the peak demand, we may have them just set up and come do regular clinics, just because, you know, they're under contract with DPH, and they're very available, and so it takes a burden off us to do that, and so, we'll probably move in that direction.
In those things, in those cases, we just have to provide space, right? They bring everything up, staffing, supplies.
Yep,
Table,
yep, give them a table, give them some chairs, and,
that
you
was
know,
it.
and if you don't show up with a table, if you don't have a table and chairs, they'll bring it.
Sounds like a pretty good deal.
Yeah, they're happy to be inside, outside a lot of the summer, so they like being inside, so.
And getting lunch.
Yes, and we bought them lunch, so that's good. So that's really the sum of the report, that I have for you today.
Great, fantastic, thank you. Does anyone have any questions for Sam? Yeah.
Sure.
Are they charging for the vaccine? Yeah.
No.
Are people's insurance getting charged after?
Yes.
Can you clarify which vaccine you're referring to? Flu or COVID?
COVID.
Yeah, so, they'll with all COVID vaccines, the vaccine itself is free. We bill for an administrative charge,
Okay.
but if you don't have insurance, if you don't have, you know, it's covered. You know, the state has a mechanism that if we're not getting reimbursed, the state will reimburse us.
Okay.
So no one's balance billed for
No.
shots?
No, not for flu, not for COVID.
Do you know if the Griffin system there, will they come to like a facility also for staff?
Of
Like a
course.
nursing home or something like that?
Yeah.
Because some of my facilities have used CVS and it was just a mess.
I don't know if they'll come
Okay.
to nursing homes. There's a
You know, I only know
separate
that from
program.
my father-in-law's place, they're going to his, so.
Yeah.
Yeah,
Just
I mean,
because
for
of
staff, yeah, because, and they did it, like, it was a 30/30 watermark, and it was just a disaster of the day. They couldn't get the computers working, and everybody was getting so upset between staff and residents, and then they did the flu, and it was just making me nervous, just doing the flu and the booster on the same day.
Well, that's what we did.
Yeah,
Yeah.
for the same people, like, I guess,
Yeah.
I just was worried about my patients, but I think it's fine.
Yeah.
Oh, they're gonna get it
Yeah.
the same day.
Yeah, but no, we don't bill, you know, I mean, we bill insurance, you know,
I think
and,
that somebody asked me about that. I
Yeah.
guess their insurance got billed and they were surprised. And I thought that they were free, so,
yeah, well, the vaccine is free.
or Medicare. I think she was
And-
concerned about Medicare.
Yeah, and, but the vaccine is covered by insurance, and there's no copay for anybody's insurance.
Okay.
Was it definitely vaccine and not test? Because I've
No.
heard a lot of like tests coming back and some abuses with,
No, it was a vaccine.
Yeah.
She was surprised and concerned that it was going to take her or potentially over her limit for Medicare.
okay.
So I figured that out just for clarification.
Sure.
It's administrative. Okay.
I just have one other question about, just with other illnesses that you're seeing, because certainly I know just, obviously this is anecdotal, but certainly in the friend groups that there's just a lot of the cold, like just common cold going around and stomach bugs. Have you been getting a lot of info about that through the schools and?
Yeah, it's, are you done, or, I'm sorry, did you want to?
Yeah. Oh, sorry.
You're more suited to respond to that. in terms of
Yeah,
having
sorry.
more finger on the
It
pulse.
was something that we brought up at our own staff, our monthly staff meeting last week. And, the way that DPH has presented it, you know, we usually refer children, one of that, you know, that laundry list of symptoms, and you're out the door. That worked very effectively last year. But kids are spending more time with one another. We're not in this total lockdown. They're going to sleepovers and parties and socializing after school. So yeah, there's more illness this year. So we asked DPH to kind of refine, you know, their referrals or what we think. And I can't say that they're going back to the, you know, 1 from column A and 2 from column B kind of thing. But we are allowed to use more nursing judgment. If the child has the history of migraines or the history of the upset stomach coming off the bus or the allergies, you know, we try to take that into consideration when we make those referrals to go out. But yeah, certainly there's been more illness in the schools.
DPH has definitely reported it's RSV season.
Yeah.
So those numbers tend to go up. I know in Stanford, RSV is starting to make its way up.
Yeah.
Although surprisingly, flu hasn't yet. So
Flu hasn't?
flu has not yet.
No, I haven't heard any
I haven't seen any
other
cases.
RSV certainly.
Mhm. So, we'll see how things go. Any other questions? Yes.
Not about, COVID, but just for the Penfield has been in field testing, are you involved in that at all in terms of just the test? I know that the schools were tested again over the summer, and those test results are on the website. Is there any more testing that's being done? Or are you involved in it at all? I mean, I just remember like, you know, when it first came out, you were in all those.
Still use types of questions? Yes. So we entered in, so we started the process, we tested everything. Then we entered into an agreement with DEP. It took about a year to negotiate the agreement. That agreement stipulated that, you know, had certain conditions, so that necessitated us to go back out to a lot of the sites, not all of them, and resample to collect more information to satisfy DEP to be able to classify materials that were placed here. Is this material considered clean fill, or is this considered a waste product? And if it's considered a waste product, then we have to take certain steps. And so that testing is going on now at sites. I think I don't want to say we finished all the sites. We've done a lot of the sites. I'm not sure of the specific
And do you think?
school sites, which ones were pulled.
Yeah, because they were done over the summer right before school
Yeah.
started. So once they were tested, are they clear? They're clear now, or is there going to be another round in 6 months?
So what we're going to do is, the process is going on now is that the company that we hire, Ty and Bond, is submitting reports to DEP that are inspection reports and our investigation reports, and then those go to DEP, and the DEP may come back and say, we don't agree with this finding, you know, and we want you to clarify this a little bit more. And so depending on the results, you know, so if the results say we have to do more work, like a remediation, then there'll be more testing. You know, because you remediate, then you test the soils around that to make sure you got everything that you thought you were going to get, and then there'll be more test results, and usually 1 or 2 of those come back with some wonky reading, and then you have to respond to that. And so there's a lot of times there's more tests that go on. It just depends on the specific site and what are the findings for that. But,
And then just once the tests are just be on the website like they were, they've been all.
yeah, that's.
So I guess to assume if there's no test results, the most current test results are on the website. And if there's not, like there's nothing that hasn't been posted right now.
So, just to clarify, so you're bringing up probably because of all the hullabaloo that went on this week regarding Penfield, is that like part of it? Because I do have a follow-up question related to that.
Even just procedure, because there were a couple of school sites that had been closed, and then they were tested, and the test results are on the website, and just kind of being, I mean, the conversations around Penfield just kind of got me going in the other direction, I was thinking about, we were all about the fill pile in the fields prior to COVID, and I know things were clear, and I just want to know if, from a school perspective, if there's anything else that we need to be really, and I can follow up with you.
Yeah, I mean, it's again, we're in a long process right now, so we're going to be, you know, going back out to different sites and testing and then developing these reports, and some of those reports, if the town feels they don't need to do more work, that they think they're done, or the company that we hired says, we think we're done, and the attorney that we're working with says, yes, I think we're done. They submit an investigation report, says, we believe we're done at this site, and here's why we think so. They submit that report to DEP. Then there's other ones where we think we have to do more work, and that will require a remedial action report, an RAR, and so we'll submit that to them to say, this is what we're going to do at this site, and then we'll do a final remediation report that sort of summarizes that. Sure. You had another question?
Well, it sounds like that the company that's hired then will end up having the final say then. Let's say, I'll just bring up the Penfield piece, because it would seem like since X amount of months or years, whatever have passed since, you know, different testing took place, it does make you wonder, you know, really what the levels are at this point, I guess, and also how the remediation would possibly stir things up and maybe even be more problematic. I don't know, that idea of like tearing down the pavilion for the third time and rebuilding is just so unbelievable.
Yeah, that issue is a separate structural issue.
Mhm.
That's not related to the fill, but
Right.
it's related in the way that it's a factor to consider in the overall plan to address that is, that we have to consider what types of remediation we may have to do there.
Right, like kill two birds, kind of.
That kind of thing, yeah. So it's the materials that are there are, under the building and under the parking lot, and so they don't present risks, and anytime we do a remediation, we have air testing and monitors on site, and we, make sure that, and that's just part of remediation, is that, you don't make it worse by doing the remediation. You have controls in place to control for that. But the Penfield will be, another long project that we'll have to work our way through, and there's factors well beyond the environmental issues there that have to be taken into consideration.
Okay.
I think just some questions about Penfield was just, one of PCP, just the waterway. And I think people are just concerned if it can leach into the water, or what about the safety-wise. And I know Time Bond first identified these sites, there was no health and safety, and that message has been consistent. I think it would just be helpful for people just to know that these contaminants are under buildings and under parking lots, and just really kind of going through the motions to make
I feel like it's analogous to like when you have an inspector come to your house and there's like asbestos tile, right? And if you encapsulate it with, carpet or something, that actually counts as appropriate remediation because it's like encapsulated, so if it is analogous from that perspective, I see what you're saying, just.
Yeah. I can bring up, we have a meeting with the contractor this week, so I can bring up, that request for greater clarity regarding, safety.
I've just gotten some questions, in part just being in that very beginning with all the field testing, and spent a lot of time talking to you and to Time Bond and to, Harvey.
Meg Harvey.
Meg Harvey,
Yep.
State DPH, who came down and just, wondered if there's any new information, so. Thank you.
Great. Any other questions, Jill? Would you like to give a report?
Yeah, I don't have much either. I just wanted to, Sally, as you said, there's more illness around. There certainly is. Last week when I presented to the staff nurses, we were just going over the numbers from one year to the next. So although we only have 59 students, I think you said, Sam, about that?
The total for the year.
Yeah. This time last year, we had only 28.
Yep.
So however much, we think last year was so devastating, it's more than twice the incidence of illness of COVID right now. And certainly more of the elementary and to a certain extent the middle school students are being affected by it. High school students have had very, very few cases since the beginning of the year. But one thing I really wanted to say, which I just sat down and I got, Addendum 7 has been released.
And it includes
recommendations for 3-foot distancing for
finally,
performance.
good. Well, that's good news. I know that they've.
Very, very good news.
Oh, yeah, really good. I mean, I just got down to the
Very, very, very.
I wasn't able to read the whole thing, so bedtime reading tonight. And that's really it. That's all I have.
Great, thank you. It should be a very interesting SDE DPH meeting tomorrow morning.
Oh, can't wait.
With that coming up. All right, fantastic. Anyone else have any questions for Jill? No? All righty. Fantastic. Well, thank you. Sans, any communications?
None?
Neither do I. Any old business? Nope. All right, thank you. New business. So on the agenda this evening, wanted to have a discussion with the board about, as we all know, there's a charter revision commission for the town charter to be reviewed and revised as appropriate, or recommended. And so the commission had asked board members, I think I had forwarded to everyone if anyone was interested in attending. But I attended that meeting, and I didn't really to have a whole lot to say because we haven't discussed it, but I did want to bring it to the board for consideration as the process goes forward. I did mention to the commission that really, and James was kind enough to send this out with the attachments, there are really primarily two areas in the charter that refer to the Board of Health. Well, one specifically in regards to the Director of Health, responsibilities, appointment, qualifications, powers and duties, and supervision. That's 9.2, and 10.9 refers to the Board of Health and Public Health Department. And it has about, again, there's a section on membership, organization, personnel, and powers and duties. And so I would really encourage everyone, if they get a chance, to take a look at those and see if you have any thoughts. What I told the commission was, as far as the section 9.2 on Director of Health, most of that is really set by Connecticut general statutes in terms of what the requirement is, what for the position, sort of the powers and duties, and really it's 4 points, 1, 2, 3, 4 points. So it's pretty basic. The second portion of the Board of Health and Public Health Department goes into a little bit more detail in terms of membership, composition, organization, and then powers and duties. So I think this is an opportunity for the board to sort of take a look at those different areas and see if they have any comments. I'd like to go ahead and at some point in time, collect our thoughts, have a discussion, and then if we have any suggestions to refer to the commission, we can go ahead and do that. One area that I want to bring up, and again, we certainly don't have to have a discussion about it, because I'm just bringing it up, is talks about the composition and membership of this board. So there's several different criteria, including a balance, a political balance. There is a requirement for a physician to be on the board. There's another requirement for two members who are licensed healthcare professionals. One representative from the Board of Ed and one representative from the Human Services Commission. As long as I've been a part of this board, I think the composition has been great. I think it's helpful to bring different people's perspectives. It's always great to have someone from the Board of Ed, as there's such a close relationship, working relationship, and in terms of policy. So the only comment that I made was I'd asked the board to consider the language licensed healthcare professionals, and to think about, one, what does that mean? Is it necessary? For example, could we have a member who isn't a licensed healthcare professional but has an extensive background in public health and PH? Now, there are two, correct, Sans? There are two seats on the board that don't require being a licensed.
There's 4 total.
4, okay.
Yeah, so there's the liaisons from the Board of Ed and
Right.
Services, and 2 of the 5 appointed by the Board of Selectmen.
Okay. So, and the reason this came to mind was because I was having discussions about who could sign medical exemptions and medical exemptions for the vaccine, and it brought this whole discussion on who could do that, right? Does it have to be independent licensed healthcare provider? Could it be a naturopath? Could it be a chiropractor? Could it be, and once again, at the end of the day, it may not make a difference in terms of the composition of the board, but it was something that I had put a little bit of thought into in terms of, should we be a little bit more specific, and is there any value in that? So I just asked folks to sort of think about that a little bit as they go through the different areas, but yes.
So one question on that, when you just brought up medical exemption though, is what was your reason for bringing that up right now as far as signing? Is that something?
Oh, no, that was just what prompted me to think about.
You mean just in your own personal practice? Because I was like, that's not something that's come to our.
Yeah, no.
Okay. I was like, I don't remember that coming up.
No, it was a point of discussion. I helped review medical exemptions, and the state was very specific about who could sign medical exemptions.
Okay, from like a validity standpoint.
Right, and the language here just says licensed healthcare professional.
Mm-hmm.
And that can be defined in a number of different ways.
Right.
So, do we want to leave it, do we want to recommend that we leave it sort of generic so that we have a very broad, or not? Because someone at some point in time, or some group, had put a lot of thought into, well, there needs to be a physician, there needs to be, again, licensed healthcare professionals, and I certainly wasn't around when the charter was first written, so I don't know what the intent exactly of that was.
Well, I do remember, I believe that was added the last time the charter was reviewed.
Was it?
I think, which is in 2006, I think it was the last time, and that was added at that point, because they wanted to, it's, and again, we've kind of been away from that, but typically the nursing program would bring, medical policies, several times a year, to the board, and there was a feeling a while back that, we need to have some, not rely on one person's opinion, the one doctor on the board to, for that we'd have a representative, and they didn't specify like RN or, they kept it kind of general to give a wider perspective. That's my recollection. I was attending board meetings back then, and
I mean, to interject, it seems like, I mean, right now, I'll just give my 2 cents. It seems like that's a good starting point, but that there has to be like holistic analysis, as my son is applying for colleges, and I just read that book, right, the Who Gets In and Why, but it's just like, you're looking at the big picture of everything in the composition, right? So I think what's important right now is that, we have physician, we have APRN, multiple physicians, APRN. I mean, I personally think it's important to have like the therapy, but also looking in the different settings, right? That somebody's working primarily with maybe more adults, elderly. Some people are having experience with pediatrics, some children. Obviously, we have like in a clinical setting, you're in like somebody's home and being in a nursing home, you know what I mean? I'm in home. So it's like, I think right now actually analyzing it, there's kind of like a nice variety of perspective. And also certainly with Christine being with Board of Ed and, a few of us having kids in the school, I think just having that personal understanding of how some of the policies are affecting the kids, in the schools, through the Board of Education, through everything that Jill needs to work on with the nurses to be able to provide it from a professional perspective, but also personal seems good. I don't know. It's just kind of a...
No, exactly, and you also have to remember that because there are other criteria that have to sort of fit, right? At some point in time, if you're too specific, then, you have to find that, left-handed unicorn with two horns that speaks French to take a particular seat, and then you run into problems. So yes, thank you for that. I do agree with you. I think there's a good composition on this board in terms of representation and perspectives, so.
Right, and I mean, you don't want everybody thinking all the same thing all the time, because then there's not room for collaboration and discussion, perspective, because there's always people in the town who are going to have another, be looking at the flip side of the coin, theoretically, right? Are you going to bring up, I know you mentioned some of the stuff from the charter. Were you going to say anything else? Like, can I bring in just one little thing?
No, absolutely.
Well,
I
just want to make sure I'm
and the point of this agenda item was, again, the charter addresses a number of different issues, and so, we're not making any decisions, we're not voting on anything. I think we're just having a discussion.
Yeah.
So if anyone has any questions or points or perspectives
I think
on the charter.
the thing when I wrote the email is when I was kind of looking through things more, reading in under the organization, it just says the Board of Health should be the general policy-making body for the Public Health Department. And then under the powers and duties, it did say shall make and amend reasonable rules for promotion and preservation of public health, health services, public schools, sanitation, and then the Board of Health shall advise the Director of Health in all matters relating to public policy and health services in the schools of the town. So it just seemed to me, as I was like reviewing it, for a variety of reasons, but because the charter came up, and obviously some of that was curiosity as we were in the midst of the townwide mask mandate, was just like, I feel like we were only kind of asked to, when the religious exemption policy came up, to kind of discuss that. But I mean, I know that, I understand that, like, early on in the pandemic, it was like more autonomous because there was like the executive power piece, but that has been since eliminated. So, I mean, I just know personally, I'd like to see maybe like a little bit more discussion sometimes as far as, getting that perspective in, so that it's not totally, I don't know, I would think it might be valuable too, so that not everything is always on your shoulders stands as well, that it's like, there is that group perspective. Because I was surprised, let's say in August, when all of a sudden there was that mandate, which, by the way, is it mandated that we have to wear masks in the town hall? That's not, right? Okay.
No, currently
Just want to talk.
Well, Sally, you bring up a good point. Just to clarify those, Sands, if I could just ask you a question about, because when I was reading this, and I agree with you that how it lays out discussion about policy, when we talk about the policies for the health department, are we talking about for the town? Or, like, for example, like this mask mandate, just as an example, but, I mean, was that a decision that the Board of Health was mandating that the town?
No, that didn't come to the Board of Health. And so that was
So what sort of policies is this board supposed to?
It seemed like it should have come to the Board of Health. That's kind of my point on that one.
Well, so there's again, the Board of Health is one entity within town that has authorities. The first selectman has broad authorities as well. And so the first selectwoman chose to issue an order under her powers, and that's what she did. And then, as she said, it was temporary, and then she rescinded that after a time being. So, she chose to do those things. So traditionally, historically, and again, I'm not saying it always has to be this way. I'm just saying this is the way it's been since I've been involved on the board. It's been 16 years now that I've been participating in Board of Health meetings, 12 of which have been as the director. And it's traditionally been that while some policies that we've asked the board to consider have wide ramifications, for example, we had, and some of you may have been here, Henry, you were here for the farmer's market. Yeah. We passed a policy relating to changing our public health code, which is the guidance document that we follow for our local rules. And so I think, a couple of years ago, we brought some changes there regarding some changes in the state and the qualified food operator changes, and we incorporated those. We changed the fee structure. So those are types of things that guide the health department. And those have traditionally been the things similar to how, the nursing program has their policy manual. And when we make changes to that, based upon changes in laws or things like that, Jill brings those forward. Our public health code changes from time to time, at the state, and so we reflect our local code to do that. And those things have broad implications for the town, but they usually rise from sort of new conditions. All of a sudden, farmers market popped up, whatever, 6 or 7 years ago, and our licensing structure didn't reflect how to license them, and so it was this weird thing of, do we license them we had a temporary license that was good for 14 days. Do we license them every 14 days? Well, it was really kind of weird, and it wasn't pro-business, and we wanted to be promoting farmers markets, and our licensing structure and the way our code was written didn't support that, and so we changed it. The Board of Health approved the policies related to that, and we changed it to make it so it's easier to, if you're, if you're a farmer in town, you don't have to pay a fee. We want farmers coming here and supporting farmers, and everybody was in agreement with that. And then the other sort of for-profit entities that have a business somewhere that are not a farmer, we wanted to make it affordable for them to do it as well. And so we passed some policies. And so that had implications for, not every single resident in town, but a certain select group. But those are policies that the health department works with every day, and, those are the types of things. Now, again, so it's been, we used to bring more things like that to them, but it's been a busy couple of years. We've been focused on a few sole issues, and a lot of these things, have authorities that, for example, the Phil Pyle has, we're bound by certain DEP regulations and things like that we don't really get even our LEP, the licensed professional the town hired, the attorney that the town hired to deal with this, they are guided by certain regulations, and they have to do certain things that they know DEP will ask for because it's in their policies and their regulations. And so, and in the same way with the pandemic, there was a lot of things passed down from the state, all the sector rules and all those kinds of things that we didn't really have much choice in the matter. But there were some things that we did locally that, in discussions with the emergency management team to talk about how is the town going to approach some of these situations. How are we going to enforce the sector rules that have been placed upon us for the town? And so, because a lot of those had, how should I say it? They affected lots of different departments. It wasn't necessarily solely a Board of Health decision on, should we cancel all events at Penfield? Because that really has, there's another board that oversees the recreation department and the policies related to that, and another department. And, yes, it's a public health related action, but it's not necessarily, all the decisions related to that aren't necessarily ours to make. And so, so a lot of those things were just kind of put upon the town, and the administration at that point made a lot of those final calls.
Well, I also think of it as, like, for example, this board has a lot of influence and actually authority over practices of the school nurses in terms of nursing policies. But we don't have the authority to then go to the Board of Ed and say, well, you must do these things.
That's exactly I really feel that has changed. I feel that it was just rubber stamping whatever the Board of Ed had decided. So I have tried to, and they've been very receptive, to kind of insert myself in some of the policy discussions that they have. Right. And I find that it's helpful. Right. And I hope that they do as well. But many of these things are just, they're either state regulations or, Board of Ed regulations, and we just really rubber stamp what it is that they say. Which is why
because you've had the opportunity to have input and discussion and
at this point,
in the creation of policy.
I mean, the food allergy policy going back years ago.
So I'm thinking to your point, I think that would be that level of collaboration and input is probably something that the board, would like I don't want to speak for everyone, but like the opportunity to hear about and maybe put some input in. Despite the fact that it doesn't fall under the purview to make policy for.
I was just seeing that certainly the policy committee has been extremely active in the Board of Ed. It's still, just the meetings from a few weeks ago, that was still happening very much so, where there was a lot of collaboration in that. So that was another thing that kind of triggered, I guess, the thought process of, okay, why aren't we doing more of that? Because obviously as a board, it's nice to have chats about things. I like that too, and just hear information, but just being able to have, an opinion, or whether it's my own or whether it's something that's been expressed, and again, I completely 100% understand the position everyone was in with having regulations handed down that just was like this top-down situation. Although, you know, I do think that there's been a little bit of wiggle room, like with certain things that were like guidance, you know what I mean, to maybe where it was, okay, but the local departments can be making their own choice on this. Like there is some semblance of that, so maybe sometimes when that comes up, there can be a discussion, you know what I mean? And maybe those are things we would just have to bring to the agenda, whether it's tied into Board of Ed or otherwise. Again, I mean, it's not necessarily like a control thing, but again, for me, it went back to like a little bit of surprise in August of just finding that something was just completely decided upon in the 1 month we didn't even have a meeting, you know what I mean? So that's where it was like a little bit too much, you know, executive decision-making. But that was just my opinion. So that's all. I'm trying to state it respectfully and all that good stuff.
And again, I would agree with you, and I think it's a valuable viewpoint in the sense that, look, for someone who's been on the board now for almost, 7 or 8 years now, when the composition changed and the people change, and, that's why we have these discussions, right? So you never know, a year, 2 years, 3 years from now, it may be a very different sort of policy input, procedure. But it starts with these sorts of discussions, and, I think it's helpful.
Well, and everything transitioned so quickly. Like, I remember when I was kind of sold on the idea, it was sold to me to be on the Board of Health. It was like, they just go over these little bits and pieces, this, that, and it seemed like it was this more low-key thing, and then all of a sudden it exploded into having the weight of the world on everyone's shoulders, kind of. But I guess it's just like wanting to be able to be participating, because clearly, like Board of Education, some other boards, it's very active collaboration, discussion, and feeling like you have some input, I guess, or some opinion versus being like, okay, head nodding, you know what I mean? But I appreciate you just like bringing it up to the board, for discussion and just to be able to think upon it and give perspective. So that's basically it.
Yeah, it's asking questions and then making, small adjustments over time, in the direction that we collectively as a board, feel as though the role of the board is. And again, that's one of the reasons why I brought it up with this. It's opportune, right? That there's a charter revision going on, and now would be the time to sort of put that input in.
To add, and it's just because we have new members coming on all the time that, some of you may not have been here, like prior to the pandemic and COVID, we had just gone through a whole community health assessment where we looked at, board members had an opportunity to participate and do interviews, and we developed a 5-year strategic plan that, pretty much a few months after we adopted it, that was the guiding document for the next 5 years for the health department that was to set our plan. We pretty much put it on a shelf and said, all right, and which we'll probably ask you, like, hey, can we take it and shift it forward, skip those 2 years and shift it forward and adopt those things, but we're actually in the process of doing another community health assessment now, and so we'll probably revise that and tweak it, but, so just that, while these past few years have been somewhat different than before, where more things have come to the board for them to consider how they can guide the health department, and provide input in what the health department should be doing, because that supports us, because, quite frequently I get, and Jill gets, and all of us get asked, hey, can you be on this committee, and can you work on this, can you take on this project, can you be an advocate for this cause, and we have to say, we have a board-approved strategic plan that sets our direction, that's based on a community health assessment, that's based on interviews and research, and that's our path, and that's what's approved, and it provides a direction for us and the guidance for us to know what's our scope and what we're working on the next few years. And again, it's flexible, and we always adjust as we have to deal with the situation of the year. So anyway, thanks for there.
All right, well, thank you. Anyone else have any other thoughts or questions? Again, this is a process, so I'll be reaching out to everyone to see if they have any thoughts, and, we can collectively offer them to the commission. And then we'll see what they do with it. All right. Great. Any other issues, discussions, points?
I think it's a good idea. I mean, I've always thought, ever since that very first meeting when I presented all those changes to you, Henry, when I first came on, that, I mean, it's just such a massive document, the policies for the nursing department that we have. And, on page 20, you'll find something that is contradicted on page 25. And to get it consistent and neat and really workable, it's a monumental job. It really is. But the nurses, I mean, that's what, when we were when it was the total lockdown in March of 2020, I just told the nurses, okay, we have all this free time. You take that section, you take the other. What do you want to see here? And I still have that pile of documents on my desk, and
It'll make its way here eventually.
it will, yeah. I mean, to the extent that we can. As I said, the regulations that come down from the DOE and the governor, in terms of the medical exemption. And what can you do about that?
And I would add...
Actually, I do have one other question. Sorry, do you want to go first, or?
I was just going to say that, it's happened, not all the time, but quite, a fair amount of occasions that the Board of Ed would actually come to us and say they would like the board to vote on an issue to say that the Board of Health is in support of this Board of Ed policy, and, so that has happened in the past.
And again, I'll bring it up if it's something you want to bring to sideline, because I know some people might want to go, or, a discussion later, that's fine. But the one other thing I guess I would want to bring in that is tied into both health department, also Board of Ed, I mean, it does seem, I've definitely heard more concerns and issues with kids, with the mask compliance, with the way that some people are handling it, with, you might have some teachers that have a very low tolerance, some teachers that have a higher tolerance. I'll tell you at the high school, it's very flexible, not throwing anyone under the bus, but, if they're eating and stuff like that. And I know there's a very different culture between Ward and Ludlow, actually, in the way that they're handling things, and there's certainly no more of a spike at one of the schools or the other. But going back to the bigger concern, though, is I feel like because of the rigidity of the mask compliance and things needing to be worn in this perfect way, there are a number of students who are, either being asked to go to the nurse's office or the main office, or being sent home. Also, some of those said students might have 504s or IEPs, which I do think is very clear, actually, in one of the policies from the state, that exceptions should be considered when they're, I have the exact language somewhere because I did research it, but alternatives should be therefore made because, again, standing back and looking at it, right, the difference between a kid, having the mask like this, or maybe having, I'll bring up somebody, let's say if there's somebody that's like an anxiety issue, right, like panic disorder or something like that, or feeling like an issue with not being able to breathe, right? And so, but then all of a sudden, this student is being told, I'm sorry, you can't participate, you can't be here in the classroom. I know something that I would like to see in that is that there is some flexibility, because that really is written at the state level, that for kids who have disabilities, who have mental health, anxiety disorders, and again, I brought that up every single time, that we know that there's been a major explosion in the mental health world, and in basically there not being enough beds in those environments now. Kind of like, what are we doing with that? Because you're talking about a child, right, who just is uncomfortable, and then you're actually removing their right to a free and appropriate education, right? Just because of an issue with a mask compliance, which again, if you're gonna take a look at that, if you're more than 3 feet away from each other, which they are, technically you're not even really considered to be a close contact to the people around you, you know, or maybe you move them.
That's not true. Child to child, no, 3 feet without a mask doesn't work. I mean, that would be a close contact. If you were a teacher and a child, that would be a close contact.
Right, but if the
Sally, I have to tell you.
Yeah. No, I'm not trying to be
No, it's okay, it's okay, but the reality of the situation is, I have gotten less than, I can think of 3 specifically, but less than 5 individuals coming to me asking for some sort of a, something else they could do, not necessarily an exemption entirely. And I've spoken to the teachers. In one case, I spoke with a parent, and I just haven't had that many people come and ask for it. I really haven't. Maybe they think it's inappropriate for me to be approached, and they're just taking it from a disciplinarian kind of approach, you know, through the schools and the teachers and the principal, but I haven't heard it.
Okay. So what is happening then right now from, let's just say, the Board of Health perspective, when that happens, when a kid maybe does have, and I know you're saying there's not many.
I'm not saying there's not many, I'm saying
that have been approached.
I haven't been approached with it.
Right, so I don't want you to take this as criticism because I've not heard of any of it being directed towards you or anything. It's more of like, what is the plan in that situation? Because the bottom line is, based on the way it was written up in the state guidelines, right, it does say that exceptions should be made to allow that child to still participate and learn, and however they do that.
They didn't really say that. They didn't sound kind of, anxiety was not mentioned in that initial document at all for mask exemptions. It may be, the state has promised us that there's going to be a mask medical exemption document coming out in October, but I haven't seen it yet. I mean, the exemptions were for people who have severe chronic obstructive pulmonary disease or facial discomfort related to burns. There were exemptions, and I've spoken to you about it, for some special ed learning sessions where, you know, the speech therapists, they need to see.
Well, we did have that email too, but I'm actually, and that's another thing, I'm actually surprised that that's not just a standard, where it's when someone is participating in speech therapy, they figure out the spacing or whatever else, but it's just, the bottom line is that they are allowed to therefore be able to see the person's mouth. And instead, my perspective is that it shouldn't be the opposite, where someone has to approach. Where instead it should actually be a proactive situation.
Yeah, and I've spoken to many administrators about that. If you want me to make a more formal recommendation for that, or at least make people aware that they can do that, that's fine. I've had kids.
I mean, we've had discussions with Rob Mancusi about all of that, and that exists, and that people have the authority and the flexibility to make accommodations when it's deemed necessary. Is that correct?
That's true. Yes, it is true.
So that, you know, like, and I mean, I just remember being part of several of the conversations in terms of how we go about that.
I mean, I've had kids with, you know, impetigo. I've had kids with severe acne. I suggest give them more mask breaks, take them outside, go for a walk, you know. And these happen to be kids with one-on-one paras, so you can afford to do that. You can't afford to do it with every child who's affected by anxiety, I'm afraid.
Right, so this is the exact language it said. I just think this is important right now, but aside from medical contraindications, there may be individuals or situations where exemptions to mask wearing should be considered. For example, those with developmental disabilities may not tolerate or be able to comply well with mask wearing in schools, but this alone should not be a basis for their exclusion.
That's right.
Schools must assess on an individual basis the appropriate accommodations for students with disabilities who are unable to wear a mask. In addition, students and staff involved with certain special education activities like speech therapy or where lip reading is required may need to be exempted from wearing a face covering mask intermittently. In cases where an exception is requested, based upon a disability, of planning and placement team, PPT, or Section 504 meeting as appropriate, should be held to consider possible programming revisions or appropriate accommodations. And it goes on to say other, like, more well-ventilated space, outdoors, et cetera. And it does say, I know above you're saying mild or intermittent respiratory or common asthma, cardiovascular diseases, kidney, similar, but again, that's it's a little loose. You could say mild respiratory issue is actually a panic attack or anxiety because it creates a hyperventilation, which is therefore associated with a respiratory issue. I mean, I'm just saying, like, just like you're saying with loose terminology, you could theoretically interpret that. And again, it just goes back to the point of, I have a real concern, like, about the fact that because a kid is maybe doing this, which we see teachers, you know, eating, drinking, things in the classroom, like, I mean, they're all happening, okay, you know, I'm just saying, like, where they're able to have their breaks and do what they need to do, and it just seems like the legalism for the sake.
Children are allowed their breaks as well.
All right, so I'm sorry.
Yeah.
So,
Yeah.
if, I think it's a great discussion to have.
Mhm.
I just want to be respectful
Yeah,
of
that's fine.
people's time. So maybe what we can do is, unless you feel this is a board issue, or unless anyone
There might
else.
something to come out with the policy before school, like, you know, the
Yeah.
breaks and, you know, what's gonna happen if someone shows up without the mask, but like a general policy, we all got an email on that.
Right, there's that,
I'm sorry, but my point is, not to dump it on the Board of Ed, but
Yeah.
This is, I mean,
if it's a board issue, I don't mind continuing the conversation. If it's
but
not
I
really
do think there is the Board of Health piece to it, because if it's a matter of appropriate mask wearing, and if a child is not, you know, just deemed to not be appropriately wearing it and is therefore missing out on school hours, like, in that document.
That's like one during their IEP or 504 plan, you know, that should be.
Right.
that is
Yeah.
the recommendation.
I'm just saying it's
Yeah.
not,
Talking to.
I know a number of individuals that's not happening, and they're being sent home from school, so they're actually
Well, then
missing school.
Parents should be, yeah, oh, okay,
You know, I think that's, like, really just concerning, like, for the sake of wearing your mask
yeah.
like this or something, or just needing to take more walks, and that the rigidity is just there where it becomes actually a disciplinarian, you know, thing where it's like, you need to go home now, I mean, we've seen how many people are outplaced now, and that increase in the outplacement budget, but anyway, I do think it's important, but if no one else wants to discuss that particular point
Well, no,
right now.
what I'd like to do, again, if there's some input that the board feels as though they can put into this discussion, then, you know, by all means, we should continue the discussion. If not, I recommend that we adjourn the meeting, and anyone else who wants to continue this discussion, that's fine, so.
It just seems like maybe if some more parameters could come from the Board of Health to specify, or from Sands and Jill, or however it's done, to basically figure out what it looks like when someone's in that situation, to still be able to keep them in school instead of sending them home.
Right.
That might be a valuable thing, again, from a proactive way, just like the speech therapy thing. Those are two pieces of input I would just like to see. You know, that there's a plan. What's the plan for the speech therapists and their patients, one-on-one in the room are allowed to space. This is their spacing. They're allowed to remove the mask, to actually see the mouth and know what they need to do. So that's like one thing that's a definitive, like, explanation. And the other one would be, if a child is indeed based on these certain either disabilities or based on these respiratory, anxiety, et cetera, concerns, however you want to place it, this is how it's going to be handled. Right?
But my point is,
Mm-hmm.
and you guys can correct me if I'm wrong, I don't know if that falls under the Board of Health.
I don't see how that falls right under the Board of Education, because the whole thing is the mask. The barrier in that situation is the way the mask is being worn, which is coming from a perspective of basically health, right? Whereas, you know, we already know that passing in the hallways of high school, you can, you know,
Right, but my point is, and anyone, please correct me if I'm if I'm misunderstanding the perspective, but I think the health department has made it very clear on how masks should be worn, what should we do, and those are the
So we're gonna
requirements and
leave it to an
recommendations.
educator and not a healthcare provider to
Yeah,
create
because
those parameters?
like what you're saying, we're making the recommendations from what the guidelines are from the state and from research, how the disciplinary acts should be school-related. And Mike Cummings, and like I said, we came out with the whole thing of, they will be sent home if not, but individuals like that.
But do you think that's
should be brought up.
appropriate for like a 7 or 8 year old who's having panic attacks or
No,
getting
that's
anxiety
different.
attacks?
Then that panic attack, then they should have a 504. The pediatrician can write a note.
Well, what
Speaking
do
about individuals, I'm
Yeah.
gonna call point of order, though I'm not really sure this is an agenda item for the Board of Health right now.
Yeah.
This is on our published agenda, that we're getting down to speaking about individual children, and I'm not discounting the people who come to you with stories and experiences. I have the same experience with parents also, and I'm gonna respect the privacy that was shared with me. Because I don't think it's really appropriate based on what is on our agenda tonight.
Okay, but, last time I checked, I think Henry Yoon is the one who's
Well, I'm gonna,
the
he can,
first.
Yeah, no.
he can rule on my point of order in terms of what's being true to.
Right, and if I've had
what is on our
somebody who
agenda.
asks me to bring up something, then there's not a privacy violation.
I'm just,
No, I just want to make sure that's very clear, Christine.
All right, so,
All I
again,
would say is that here, I think what our responsibility is broad, to make broad recommendations, because we want to make sure we keep as many children safe as we possibly can. That's our goal. In terms of all these individual situations, absolutely, it shouldn't be so, but I think we have to leave that up to there are professionals at the schools, whether it's the therapists, whether it's any number of the professional teachers, the administration. I think we have to give them the ability to make these kind of individual decisions, which what you're saying, I completely support. I mean, there are lots of different situations where it may be difficult for a child to wear a mask. And you take those individually, but I think as a Board of Health, we have to start with saying that, is it appropriate for, in the general sense, for all these children, the baseline that they should still be wearing masks, because we're seeing, we still see some kids get sick, and we want to try to do whatever we can do to keep as many children healthy. To me, that seems like the way for us to approach it.
Yeah, I hear you. I just think it goes back to we're saying to keep children healthy, but it's also not healthy for mental health, for someone to be or for multiple people to be ostracized from a situation. And this is not just one that has come to my attention, but numerous. So that's why it's I don't feel that I'm singling out. And again, I'll reiterate that was something that was brought very specifically. It's something that this person wanted to address. So there's absolutely zero privacy violation.
Sally, and I was not saying, I'm saying.
still finishing my thought right now. And then the second thing is just with the speech, back to the speech therapy. I do think, again, that is Board of Health, because I don't think that people in a school, administrators, and I know very specifically a friend of mine and again, she brought this up to me specifically to address, whose daughter was receiving speech therapy, that the speech therapist said, I never heard anything about the possibility of being able to remove my mask, even though it's very, very clear in the document from the state that is absolutely allowed. So I would like to see that is just coming from the Board of Health, then communicated to the schools, to the therapist, the speech therapist, that's something that's allowed, because that's something that's necessary to do effective work.
okay, so, thank you. I'd like to close the discussion at this point. If I can get a motion to, end the meeting? Can I get a second? All those in favor? Thank you, meeting adjourned. Thank you for all your input and thoughts, and, thought-provoking.
Thank you.